Okay, so I'm in a preparatory pose for the pointer dog, it's called. This basic position, even though it's not too basic, because it's actually there's a lot going on here, is a key posture that Stuart McGill uses, who's one of the leading experts on back pain. And he teaches this to a lot of people with severe back pain. I teach this a lot in my classes and to clients as well because it strengthens the abductors. These are the muscles that help stabilize your hips. And so a lot of hip problems, a lot of lower back problems are because of weakness in these muscles. Okay? So our hands are below our shoulders. I'm separating my fingertips as much as I can to distribute weight. My knees, hopefully, are below my hips. My knees are hip width apart. And first thing I'm going to do, I'm going to make sure that, I'm going to check out my lower back. Okay, I'm not in anterior tilt or posterior tilt. I'm trying to find a neutral for me, so I'm trying to find a middle ground. So if you're unsure, go deep anterior, go deep posterior, and find the middle ground of those two. Okay, hopefully that's where I'm at. Then my arms, these are super important because I'll show you from this angle. We don't want to do this bulldog pose posture because then your arms are in internal rotation. We want to, without moving the hands too much, do you see how the insides of my elbows are kind of pointed forward? That way, my shoulder blades are in a good neutral position and my shoulders are in external rotation, not internal rotation. Let's go back to this angle, okay? Then I'm going to make sure my head's in a neutral position, not too far low, not too far back, okay? I'm going to push down with both hands. I'm going to lift my left knee up. Now, a big mistake that I see with people is when they lift that left foot up, this hip shifts out to the right. You have to stabilize here with this right hip. Then I'm lifting the opposing arm. Now, you can bring it straight or you can bring it out right about 45 degrees. Why 45 degrees? Because then it affects the lower traps. This leg also does not lift up too high or too low. You want to try to keep both butt cheeks even. Hopefully mine is. Okay? If you find this too difficult, place the hand back and just work on the hip. That's it. Okay? But if you can lift that arm up and balance at the same time, great. Stay for as many breaths as you can, and when you come back, keep those hips in line. Don't let the hip comes back. Hip shift, because look, a lot of people do this. You want to make sure that the hip is still stable the whole time that you're coming back. Okay? Then rest in between, and then you're going to switch on up. I'm making sure that my shoulders are in external rotation. I'm going to stabilize with my left hip. So if I were to switch to this side so you can kind of see from this angle, hopefully I won't kick anything. Okay? Okay? I just kicked my sketty. Okay? And then, sorry, I need to do the opposite side. Sorry about that. Now the right leg comes up. Okay? Left arm. Okay? I'm making sure that my hips are stable. I am shaking a little bit because this is the weaker side for me. So this is the side that I'm probably going to do twice. Again, I'm making sure this arm is not overextended. I didn't mention that before. Don't overextend that arm. Keep it in a neutral position. Okay? And then when I want to come back, arm and leg at the same time, making sure the hips stay in the middle. All right? So refresher. This is what we're working on. The sides here, the abductors, the gluteus medius and minimus. Try to prevent the hips from shifting to the left or right. If you're not sure if you're doing it correctly, use a mirror or have someone in front of you bringing shame if you do it wrong. Shame always works, yes? Anyway, jokes aside, thank you.